Question 1. Research into the effectiveness and appropriateness of a new proposed screening program for a specific chronic disease in a defined Canadian population has been initiated. The research team is tasked with evaluating whether the program aligns with current best practices and regulatory expectations for preventive health initiatives in Canada. Which of the following approaches would best guide this evaluation? Option A. Comprehensive review of peer-reviewed literature on the screening test's sensitivity, specificity, predictive values, and its impact on morbidity and mortality in similar populations, alongside an assessment of alignment with Health Canada guidelines and relevant provincial public health strategies. Option B. A review of the screening test's historical usage in other countries, prioritizing programs that have been widely adopted, regardless of their documented impact on health outcomes or adherence to Canadian regulatory standards. Option C. An assessment of the level of interest expressed by the target population and healthcare providers in adopting the screening program, based on informal surveys and anecdotal feedback. Option D. A cost-benefit analysis focusing primarily on the direct financial costs of implementing the screening program, without detailed consideration of its clinical effectiveness or potential harms. The correct answer is A. A comprehensive review of peer-reviewed literature on the screening test's sensitivity, specificity, predictive values, and its impact on morbidity and mortality in similar populations, alongside an assessment of alignment with Health Canada guidelines and relevant provincial public health strategies. Explanation. This scenario presents a professional challenge due to the inherent complexities of implementing and evaluating screening programs within the Canadian healthcare system, governed by provincial and federal regulations and guidelines. Physicians must balance evidence-based practice with patient autonomy, resource allocation, and public health objectives. The decision-making process requires a deep understanding of the principles of preventive medicine, the evidence supporting specific screening modalities, and the ethical considerations surrounding their application. The correct approach represents best professional practice because it prioritizes a comprehensive, evidence-based evaluation of the screening program's effectiveness and appropriateness for the target population. This aligns with the principles of quality improvement and patient safety, which are paramount in Canadian medical practice. Adherence to guidelines from bodies like Health Canada and provincial ministries of health ensures that screening programs are implemented in a manner that maximizes benefits and minimizes harms, while respecting patient rights and promoting equitable access to care. An incorrect approach that focuses solely on the perceived demand for a screening test without robust evidence of its efficacy or impact on health outcomes fails to meet the standards of evidence-based medicine. This could lead to the misallocation of healthcare resources, unnecessary patient anxiety, and potential harms from false positives or overdiagnosis, violating the ethical principle of non-maleficence. Another incorrect approach that disregards established guidelines and relies on anecdotal evidence or personal opinion for program implementation is professionally unacceptable. This demonstrates a failure to engage with the scientific literature and regulatory frameworks that guide best practices in public health and preventive medicine, potentially leading to suboptimal patient care and a breach of professional responsibility. A further incorrect approach that neglects to consider the broader public health implications and cost-effectiveness of a screening program, focusing only on individual patient requests, is also problematic. This overlooks the physician's role in contributing to the efficient and effective use of healthcare resources for the benefit of the entire population, a key consideration in Canadian healthcare policy. The professional decision-making process for similar situations should involve 1. Identifying the clinical question or problem. 2. Conducting a thorough literature search to identify evidence-based guidelines and research on the screening program. 3. Evaluating the program's scientific validity, clinical utility, and impact on health outcomes. 4. Considering ethical implications, including patient autonomy, informed consent, and equity of access. 5. Consulting relevant regulatory bodies and professional organizations for guidance. 6. Implementing the program in a way that allows for ongoing monitoring and evaluation. Question 2. The risk matrix shows a significant increase in preventable chronic diseases within a specific urban neighborhood, disproportionately affecting low-income families and recent immigrants. The neighborhood has limited access to fresh produce and a high prevalence of sedentary lifestyles. considering the principles of health promotion and disease prevention as guided by the Medical Council of Canada's framework. Which of the following implementation strategies would be most effective and ethically sound? Option A. Implementing a mandatory public health campaign with strict guidelines on dietary intake and exercise, coupled with financial penalties for non-compliance, and relying solely on existing healthcare facilities for information dissemination. Option B. Focusing all efforts on a single, large-scale public awareness campaign utilizing mass media to highlight the dangers of unhealthy lifestyles, without specific community engagement or tailored interventions. Option C. Developing and distributing a detailed informational pamphlet outlining the risks of chronic diseases and recommending lifestyle changes, with the expectation that individuals will independently seek out resources and implement the advice. Option D. Launching a comprehensive, multi-component program that includes community-based education workshops on healthy eating and physical activity, establishing partnerships with local community centers to create accessible exercise programs, and advocating for improved access to affordable, nutritious food options through local initiatives and policy changes. The correct answer is D. Launching a comprehensive, multi-component program that includes community-based education workshops on healthy eating and physical activity, establishing partnerships with local community centers to create accessible exercise programs, and advocating for improved access to affordable, nutritious food options through local initiatives and policy changes. Explanation. This scenario presents a common challenge in public health, balancing the need for broad population-level interventions with the practicalities of resource allocation and community engagement. The risk matrix highlights a significant public health concern, requiring a strategic and evidence-informed response. The professional challenge lies in selecting the most effective and ethically sound health promotion and disease prevention strategy that aligns with the principles of the Medical Council of Canada, LMCC, and relevant Canadian public health guidelines. The correct approach prioritizes a multifaceted strategy that addresses the identified risk through a combination of education, access improvement, and community partnership. This aligns with the MCC's emphasis on evidence-based practice, patient-centered care, and the social determinants of health. By engaging community leaders and tailoring interventions to local needs, this approach fosters buy-in and sustainability, which are crucial for effective health promotion. It also reflects the ethical obligation to promote health equity by reaching vulnerable populations. An incorrect approach that focuses solely on a single, top-down educational campaign without considering community context or access to resources would be professionally deficient. This fails to acknowledge the diverse needs and barriers faced by different segments of the population, potentially leading to ineffective interventions and exacerbating health inequities. Ethically, it neglects the principle of beneficence by not ensuring the intervention is accessible and relevant to all. Another incorrect approach that relies on punitive measures or mandates without adequate public consultation or support mechanisms would also be problematic. Such strategies can erode trust, lead to resistance, and fail to address the underlying causes of the health issue. This contravenes the ethical principle of respect for autonomy and can be seen as a failure to engage in collaborative health promotion, which is a cornerstone of Canadian public health practice. Finally, an approach that neglects to evaluate the effectiveness of implemented strategies or adapt them based on feedback would be a failure of professional responsibility. The MCC expects physicians to engage in continuous quality improvement and to be accountable for the outcomes of their interventions. Without evaluation, it is impossible to determine if resources are being used effectively or if the health promotion goals are being met. The professional decision-making process for similar situations should involve a thorough assessment of the population's needs, an understanding of the social and environmental determinants of health, and a review of evidence-based prevention strategies. It requires collaboration with public health agencies, community stakeholders, and patients themselves to co-design interventions that are culturally appropriate, accessible, and sustainable. Ethical considerations, including equity, autonomy, and beneficence, must guide the selection and implementation of any health promotion strategy. Question 3. Risk assessment procedures indicate a patient presenting for a minor surgical procedure has a history of cognitive impairment. The physician is aware of this history, but has not yet formally assessed the patient's capacity to consent to the procedure. the physician is considering how to proceed with obtaining consent. Which of the following represents the most appropriate course of action for the physician? Option A. Provide the patient with a simplified explanation of the procedure and obtain their verbal agreement, as the procedure is considered minor. Option B. Delay the procedure until a formal psychiatric evaluation can be completed to definitively determine the patient's capacity. Option C. Proceed with the surgical procedure after obtaining consent from the patient's spouse, assuming the spouse will act in the patient's best interest. Option D. Conduct a thorough assessment of the patient's capacity to consent to the specific surgical procedure, ensuring the patient understands the nature, benefits, risks, and alternatives, and can communicate their decision. The correct answer is D. Conduct a thorough assessment of the patient's capacity to consent to the specific surgical procedure, ensuring the patient understands the nature, benefits, risks, and alternatives, and can communicate their decision. Explanation. This scenario presents a professional challenge because it requires balancing a patient's autonomy with the physician's duty of care, particularly when a patient's capacity to make informed decisions is in question. The physician must navigate the complexities of assessing capacity, ensuring the patient receives adequate information, and respecting their right to refuse treatment, all within the legal and ethical framework governing medical practice in Canada. The core of the challenge lies in upholding the principles of informed consent while ensuring patient safety and well-being. The correct approach represents best professional practice because it prioritizes a thorough and documented assessment of the patient's capacity to consent. This aligns with the fundamental ethical and legal principles of informed consent, which require that patient be capable of understanding the information provided, appreciating the consequences of their decisions, and communicating their choice. In Canada, this is guided by provincial/territorial legislation and common law principles related to consent to treatment, emphasizing patient autonomy. The physician's responsibility is to facilitate the patient's decision-making process, not to make the decision for them, provided they have capacity. An incorrect approach that involves proceeding with the procedure without a formal capacity assessment fails to uphold the patient's right to informed consent and could lead to legal and ethical repercussions. It bypasses a crucial step in the consent process and assumes capacity without verification. Another incorrect approach, that of immediately seeking consent from a substitute decision maker without first attempting to assess the patient's own capacity, infringes upon the patient's autonomy. While substitute decision makers are vital when a patient lacks capacity, the primary right to consent rests with the capable individual. Finally, an incorrect approach that involves withholding necessary information from the patient to expedite the consent process is a direct violation of the informed consent doctrine. Patients have a right to receive all relevant information about their condition, proposed treatment, alternatives, and risks and benefits to make a truly informed decision. The professional decision-making process in such situations should involve a systematic approach. First, assess the patient's capacity to consent to the specific treatment in question. If capacity is present, proceed with a comprehensive informed consent discussion. If capacity is questionable or absent, then follow established legal and ethical protocols for involving a substitute decision maker, ensuring all steps are documented. Throughout this process, clear communication, empathy, and respect for the patient's values and preferences are paramount. Question 4. Which approach would be most appropriate for a physician managing a patient presenting with new-onset, nonspecific abdominal pain, where initial vital signs are stable and there are no immediate red flags for a surgical emergency? Option A. Proceed with a comprehensive abdominal ultrasound to rule out a broad range of intra-abdominal pathologies. Option B. Initiate a detailed history and focused physical examination to generate a differential diagnosis and guide further investigations. Option C. Prescribe symptomatic treatment for pain and advise the patient to return if symptoms worsen significantly. Option D. Order a broad-spectrum laboratory panel including complete blood count, electrolytes, liver function tests, and amylase, without a focused physical exam. The correct answer is A. Proceed with a comprehensive abdominal ultrasound to rule out a broad range of intra-abdominal pathologies. Explanation. This scenario presents a common clinical challenge involving a patient with a potentially serious condition requiring a timely and accurate diagnosis, balanced against the need for patient comfort and minimizing unnecessary interventions. The professional challenge lies in navigating the uncertainty of the patient's symptoms and determining the most appropriate next steps in their care, considering both diagnostic yield and potential patient harm or discomfort. Careful judgment is required to avoid both diagnostic delay and over-investigation. The correct approach represents best professional practice by prioritizing a systematic and evidence-based diagnostic pathway that begins with less invasive measures and escalates as indicated by clinical findings. This aligns with the principles of good medical practice as espoused by the Medical Council of Canada, LMCC, emphasizing patient-centered care, evidence-informed decision-making, and the judicious use of resources. Specifically, initiating a focused history and physical examination is the foundational step in any diagnostic process, allowing for the generation of differential diagnoses and guiding further investigations. This approach respects the patient's autonomy by involving them in the decision-making process regarding further investigations and their rationale. An incorrect approach that immediately proceeds to advanced imaging without a thorough clinical assessment fails to adhere to the principle of starting with the least invasive and most informative diagnostic steps. This can lead to unnecessary patient anxiety, potential radiation exposure, and increased healthcare costs without a clear clinical indication. Ethically, it may also represent a failure to adequately consider the patient's well-being and the principle of non-maleficence. Another incorrect approach, such as delaying further investigation due to a mild initial presentation, could lead to a misdiagnosis and potential harm to the patient, violating the duty of care and the principle of beneficence. A third incorrect approach, relying solely on a single diagnostic test without considering the broader clinical picture, demonstrates a lack of comprehensive clinical reasoning and may result in misinterpretation of results or overlooking other contributing factors. Professionals should employ a structured decision-making framework that begins with a comprehensive assessment of the patient's history and physical examination findings. This should be followed by the formulation of a differential diagnosis, prioritizing the most likely and most serious conditions. Based on this differential, a stepwise approach to investigation should be planned, starting with the least invasive and most cost-effective tests, and escalating to more advanced or invasive procedures only when clinically indicated and justified by the potential diagnostic yield. Throughout this process, open communication with the patient regarding the diagnostic plan, its rationale, and potential risks and benefits is paramount. Question 5. The review process indicates that a physician is assessing a patient presenting with symptoms suggestive of a gastrointestinal issue. The physician needs to perform a physical examination of the abdomen, considering the potential for patient discomfort and the need for a thorough diagnostic assessment. Which of the following examination techniques demonstrates the most appropriate professional approach? Option A. Explain to the patient that a physical examination of the abdomen is necessary. Describe the steps involved, including palpation and percussion, and ask for their consent before proceeding, offering to stop if they experience significant discomfort. Option B. Begin palpation of the abdomen immediately to assess for tenderness and masses, proceeding systematically through all quadrants without prior explanation to the patient, assuming it is a standard part of the examination. Option C. Perform a brief visual inspection of the abdomen and then proceed directly to auscultation, skipping palpation and percussion to minimize any potential for patient discomfort. Option D. Conduct a detailed history of the patient's symptoms and then perform a very light superficial palpation of the entire abdomen, avoiding any deep palpation to prevent any possibility of causing pain. The correct answer is B. Begin palpation of the abdomen immediately to assess for tenderness and masses, proceeding systematically through all quadrants without prior explanation to the patient, assuming it is a standard part of the examination. Explanation. This scenario presents a professionally challenging situation due to the need to balance thoroughness with patient comfort and efficiency, particularly when examining a potentially sensitive body system. The physician must employ examination techniques that are both diagnostically effective and ethically sound, adhering to the principles of patient-centered care and professional conduct as outlined by the Medical Council of Canada, LMCC. Careful judgment is required to select the most appropriate approach given the patient's presentation and the potential for discomfort. The correct approach represents best professional practice because it prioritizes patient dignity and comfort while ensuring a comprehensive assessment. This aligns with the MCC's emphasis on ethical practice, which includes obtaining informed consent, minimizing patient distress, and conducting examinations in a manner that respects privacy. By explaining the procedure and offering the patient control over the examination, the physician fosters trust and collaboration, which are fundamental to effective patient care. This approach also ensures that the examination is performed in a way that maximizes diagnostic yield without causing undue anxiety or embarrassment. An incorrect approach that involves proceeding with a potentially invasive examination without adequate explanation or consent would represent a significant ethical failure. This violates the principle of patient autonomy and informed consent, which is a cornerstone of medical practice in Canada. Such an approach could lead to patient distress, a breakdown of the physician-patient relationship, and potential complaints to the Provincial Medical Regulatory Authority. Furthermore, it demonstrates a lack of professional judgment in assessing the patient's needs and comfort. Another incorrect approach, such as performing a superficial examination that omits key components due to a desire to avoid potential patient discomfort, would be diagnostically inadequate. This fails to meet the professional obligation to conduct a thorough examination and could lead to misdiagnoses, impacting patient safety and outcomes. This demonstrates a lack of commitment to providing high-quality medical care, which is expected of all physicians licensed by the MCC. The professional decision-making process for similar situations should involve a systematic approach. First, assess the clinical indication for the examination and the potential benefits and risks. Second, consider the patient's individual circumstances, including their comfort level, previous experiences, and any expressed concerns. Third, communicate clearly and empathetically with the patient, explaining the purpose of the examination, what it will involve, and any potential discomfort. Fourth, obtain informed consent, ensuring the patient understands and agrees to proceed. Finally, adapt the examination technique to maximize diagnostic accuracy while minimizing patient distress, always maintaining professionalism and respect. Question 6. The analysis reveals that a physician is conducting a new patient assessment and is concerned about the time allocated for the appointment. The physician needs to document the patient's history effectively to ensure comprehensive care and adherence to professional standards. Which of the following approaches best reflects the required standard for documenting a patient's history in the context of LMCC expectations? Option A. Record the patient's history based on assumptions about common conditions for their age and gender, and only document information that is easily recalled by the patient. Option B. Systematically inquire about and document the patient's chief complaint, history of present illness, past medical history, surgical history, family history, social history, allergies, and current medications, probing for details and clarifying information as needed. Option C. Summarize the patient's reported history in broad terms, focusing only on information directly related to the chief complaint and omitting details about past medical conditions or social factors. Option D. Briefly note the patient's primary concern and rely on the patient to volunteer any other relevant historical information without specific prompting. The correct answer is B. Systematically inquire about and document the patient's chief complaint, history of present illness, past medical history, surgical history, family history, social history, allergies, and current medications, probing for details and clarifying information as needed. Explanation. This scenario presents a common implementation challenge in healthcare documentation, specifically concerning the completeness and accuracy of patient history. The professional challenge lies in balancing the need for comprehensive information with the practical constraints of time and patient interaction, while adhering to the rigorous standards expected by the Medical Council of Canada, LMCC. Ensuring that all relevant historical data is captured accurately and legibly is paramount for patient safety, continuity of care, and legal defensibility. The correct approach emphasizes a systematic and thorough method of eliciting and recording patient history. This aligns with the LMCC expectations for physicians to maintain accurate and complete medical records. Best professional practice dictates that a physician should actively inquire about all pertinent aspects of a patient's medical, social, and family history, and document these findings in a clear, concise, and organized manner. This includes not only the presenting complaint, but also past medical conditions, surgical history, medications, allergies, family history of significant illnesses, and relevant social factors, e.g., occupation, lifestyle, substance use. This comprehensive approach minimizes the risk of misdiagnoses, inappropriate treatment, and adverse drug events, thereby upholding the physician's duty of care and professional responsibility as outlined by the LMCC. An incorrect approach that relies solely on the patient's self-report without further probing or verification fails to meet the standard of thoroughness. This could lead to incomplete or inaccurate documentation, potentially resulting in diagnostic errors or suboptimal management plans. Ethically, it represents a failure to exercise due diligence in gathering essential information. Another incorrect approach, which involves summarizing the history without detailing specific findings or the patient's responses to key questions, sacrifices crucial detail. This lack of specificity can render the record less useful for subsequent consultations or for understanding the patient's evolving condition. It also makes it difficult to assess the thoroughness of the initial assessment. Furthermore, relying on assumptions or omitting potentially sensitive but relevant information due to time constraints is a significant ethical and regulatory failure. The LMCC expects physicians to address all relevant areas of history, even if they require more time or sensitive questioning, to ensure comprehensive care. The professional decision-making process for similar situations should involve prioritizing patient safety and the integrity of the medical record. Physicians should adopt a structured approach to history taking, utilizing established frameworks, e.g., chronological, system-based, to ensure all relevant domains are covered. When faced with time constraints, it is crucial to identify the most critical information for the immediate clinical decision and to make a plan for follow-up to gather any remaining essential details. Documentation should reflect not only what was obtained, but also any limitations or areas that require further exploration. Open communication with the patient about the importance of a thorough history can also foster collaboration and improve the quality of information gathered. Question 7. Compliance review shows a physician is obtaining a patient's medical history. The patient, who recently immigrated to Canada from a country with a collectivist culture, appears hesitant to make direct eye contact and speaks softly, often deferring to their accompanying adult child for answers. The physician is concerned about obtaining a complete and accurate history. Which of the following approaches best balances the need for comprehensive information with cultural sensitivity? Option A. Directly ask the patient to make eye contact and speak louder to ensure clear communication, explaining that this is necessary for an accurate medical assessment. Option B. Proceed with asking questions primarily to the adult child, assuming they are the primary decision maker and have full knowledge of the patient's medical history. Option C. Gently acknowledge the patient's apparent discomfort and inquire if they would prefer to have their adult child assist with answering questions, while also reassuring them that their personal health information will be kept confidential. Option D. Focus solely on objective physical examination findings, minimizing the verbal history-taking component due to the perceived communication barriers. The correct answer is C. Gently acknowledge the patient's apparent discomfort and inquire if they would prefer to have their adult child assist with answering questions, while also reassuring them that their personal health information will be kept confidential. Explanation. This scenario presents a professional challenge due to the inherent diversity within the Canadian population and the potential for cultural misunderstandings to impede effective patient care. The physician must navigate a situation where a patient's cultural background may influence their communication style, understanding of health, and willingness to disclose sensitive information. Careful judgment is required to ensure that the history-taking process is both comprehensive and culturally sensitive, respecting the patient's autonomy and promoting trust. The correct approach represents best professional practice by prioritizing a patient-centered and culturally humble method of history-taking. This aligns with the ethical principles of beneficence and non-maleficence, ensuring that the physician acts in the patient's best interest and avoids causing harm through misunderstanding or insensitivity. Specifically, it adheres to the principles of the Canadian Medical Association, CMA Code of Ethics, which emphasizes respect for patient dignity, autonomy, and the importance of understanding the patient's context. By actively seeking to understand the patient's cultural beliefs and practices, the physician can tailor their communication and diagnostic approach, leading to more accurate information gathering and ultimately, better health outcomes. This approach fosters a therapeutic alliance built on trust and mutual respect, which is fundamental to effective medical practice in Canada. An incorrect approach that assumes a universal understanding of health concepts or communication norms would be a significant regulatory and ethical failure. This could lead to misdiagnosis, inadequate treatment, and patient dissatisfaction. For instance, failing to inquire about traditional healing practices or family involvement in decision-making, based on the physician's own cultural assumptions, violates the principle of respecting patient autonomy and could lead to a breakdown in the patient-physician relationship. Another incorrect approach might involve dismissing or devaluing the patient's cultural beliefs, which is not only unethical, but also contravenes the CMA's emphasis on cultural competence and sensitivity in healthcare delivery. Such dismissiveness can create a barrier to communication, preventing the patient from sharing vital information. The professional reasoning process for similar situations should involve a conscious effort to move beyond one's own cultural lens. This includes practicing cultural humility by acknowledging that one does not know everything about another's culture and being open to learning. It involves active listening, asking open-ended questions, and observing nonverbal cues. When faced with unfamiliar cultural practices or beliefs, the professional should inquire respectfully about their meaning and significance to the patient, rather than making assumptions. This iterative process of inquiry, reflection, and adaptation ensures that the care provided is both medically sound and culturally appropriate, upholding the highest standards of professional conduct as expected within the Canadian healthcare system. Question 8. Operational review demonstrates that in a remote emergency setting, initial responders to a cardiac arrest are often delayed in receiving advanced cardiac life support equipment and personnel. Considering the principles of basic life support, BLS, and advanced cardiac life support, ACLS, as mandated by Canadian medical practice, what is the most appropriate immediate course of action for the initial responders to optimize patient outcomes? Option A. Wait for the arrival of advanced life support equipment and personnel before initiating any resuscitation efforts to ensure a coordinated approach. Option B. Immediately commence high-quality chest compressions and artificial ventilation, and simultaneously activate the system for advanced support while preparing for defibrillation if indicated. Option C. Begin advanced airway management and pharmacological interventions as soon as possible, even if chest compressions are suboptimal. Option D. Focus solely on administering intravenous fluids and medications as soon as they are available, assuming basic interventions will be handled by the advanced team. The correct answer is B. Immediately commence high-quality chest compressions and artificial ventilation, and simultaneously activate the system for advanced support while preparing for defibrillation if indicated. Explanation. Scenario analysis. This scenario presents a common yet critical challenge in emergency medicine, optimizing the delivery of basic life support, BLS, and advanced cardiac life support, ACLS, within a resource-constrained environment. The professional challenge lies in balancing the immediate need for effective resuscitation with the logistical realities of staffing, equipment availability, and established protocols. Careful judgment is required to ensure patient safety and adherence to best practices while acknowledging system limitations. Correct approach analysis. The correct approach prioritizes the immediate implementation of high-quality BLS by the initial responders, ensuring continuous chest compressions and prompt defibrillation if indicated, while simultaneously initiating the process for advanced support. This aligns with the fundamental principles of resuscitation, emphasizing early and effective CPR as the cornerstone of survival. The Canadian Network for Emergency Medicine, CNEM, guidelines which inform LMCC examinations stress the importance of a systematic approach to cardiac arrest management, starting with basic interventions and escalating as resources become available. This approach maximizes the patient's chance of survival by addressing the most critical physiological needs first. Incorrect approaches analysis. One incorrect approach involves delaying the initiation of chest compressions until advanced equipment and personnel are fully assembled. This violates the core tenet of BLS, which is to begin immediate chest compressions to maintain vital organ perfusion. Such a delay significantly reduces the likelihood of successful resuscitation and is contrary to all established resuscitation guidelines, including those referenced by the LMCC. Another incorrect approach is to solely focus on administering medications without ensuring adequate ventilation and chest compression. While ACLS protocols include pharmacological interventions, These are adjunctive to effective CPR. Failure to maintain high-quality compressions and ventilation renders medication administration less effective and can lead to critical delays in physiological support, a clear deviation from best practices and regulatory expectations. A third incorrect approach is to prematurely terminate resuscitation efforts based on initial unresponsiveness without a thorough assessment of reversible causes or adherence to established termination of resuscitation (TOR) criteria. Canadian medical regulations and ethical guidelines emphasize a systematic and evidence-based approach to patient care, including resuscitation. Premature termination is not only clinically unsound, but also ethically problematic, potentially failing to provide the patient with the full benefit of available medical interventions. Professional reasoning. Professionals facing such situations should employ a structured decision-making process. This involves 1. Rapidly assessing the scene and the patient's condition. 2. Immediately initiating high-quality BLS according to established protocols. 3. Activating the appropriate emergency response system for advanced support. 4. Continuously reassessing the patient and the effectiveness of interventions. 5. Communicating clearly with team members and other healthcare professionals. 6. Adhering to established guidelines and protocols, such as those promoted by the Heart and Stroke Foundation of Canada, which are foundational to LMCC standards. Question 9. During the evaluation of a patient presenting with symptoms suggestive of a urinary tract infection, the physician needs to obtain a clean catch midstream urine specimen for urinalysis. Which of the following actions best ensures the integrity of the specimen and respects the patient's dignity? Option A. The physician instructs the patient to urinate directly into the collection cup without specific guidance on cleansing or midstream collection. Option B. The physician hands the patient a collection cup and assumes they know how to perform a clean catch midstream collection. Option C. The physician provides the patient with a sterile collection cup and a clean wipe, instructing them to collect the specimen in the washroom and return it promptly. Option D. The physician asks a nursing assistant to collect the urine sample directly from the patient while they are in bed. Correct answer is C. The physician provides the patient with a sterile collection cup and a clean wipe, instructing them to collect the specimen in the washroom and return it promptly. Explanation. Scenario analysis. This scenario presents a common clinical challenge involving the collection of a urine specimen for urinalysis. The professional challenge lies in ensuring the integrity and accuracy of the specimen while respecting patient privacy and comfort. Mismanagement of specimen collection can lead to inaccurate diagnostic results, potentially resulting in misdiagnosis, inappropriate treatment, or delayed care. Furthermore, failure to adhere to proper collection protocols can raise ethical concerns regarding patient dignity and confidentiality. The physician must balance the need for a reliable sample with the patient's right to privacy and the practicalities of specimen collection in a clinical setting. Correct approach analysis. The correct approach emphasizes patient-centered care and adherence to established medical guidelines for urine specimen collection, providing clear, step-by-step instructions to the patient regarding the collection process, including hand hygiene, proper container use, and midstream collection, is paramount. Explaining the rationale for these steps helps the patient understand the importance of an accurate sample. Offering appropriate privacy during collection, such as a private washroom and a clean collection cup, is a fundamental ethical and professional requirement. This approach ensures the specimen is representative of the patient's urine, minimizing contamination and maximizing diagnostic utility, thereby aligning with the principles of good medical practice and patient care as expected within the Canadian medical framework. Incorrect approaches analysis. One incorrect approach involves directly collecting the urine sample from the patient without providing clear instructions or privacy. This is professionally unacceptable as it disregards patient autonomy and dignity, potentially causing embarrassment and distress. It also significantly increases the risk of specimen contamination, rendering the urinalysis results unreliable and leading to potential diagnostic errors. This failure violates the ethical obligation to respect patient privacy and the professional responsibility to obtain accurate diagnostic information. Another incorrect approach is to delegate the entire specimen collection process, including direct handling of the specimen, to an unregulated individual without proper training or supervision. While delegation of tasks is common, the responsibility for ensuring the integrity of the specimen and patient care remains with the physician. This approach risks breaches in patient confidentiality, potential for specimen mishandling, and a lack of accountability for the accuracy of the collected sample. It fails to uphold the standards of care and professional oversight expected within the Canadian healthcare system. A third incorrect approach is to assume the patient understands the collection process without explicit instruction, particularly if the patient has cognitive impairments or is unfamiliar with the procedure. This can lead to an improperly collected sample, compromising the diagnostic value of the urinalysis. It demonstrates a lack of thoroughness and patient assessment, which is contrary to the principles of providing individualized and effective patient care. Professional reasoning. Professionals should employ a decision-making framework that prioritizes patient safety, accuracy of diagnostic information, and ethical considerations. This involves a systematic approach. 1. Assess the patient's understanding and ability to collect the specimen independently. 2. Provide clear, concise, and culturally sensitive instructions tailored to the individual patient's needs. 3. Ensure adequate privacy and a suitable environment for specimen collection. 4. Offer assistance or alternative collection methods if necessary while maintaining patient dignity. 5. Supervise or verify the collection process as appropriate to ensure specimen integrity. 6. Document the collection process and any deviations from standard protocol. This framework ensures that the diagnostic process is both clinically sound and ethically responsible, upholding the standards of medical practice in Canada. Question 10. The audit findings indicate a pattern of delayed reporting of certain communicable diseases by a physician to the provincial public health authorities, despite clear evidence of diagnosis. The physician has consistently cited patient privacy concerns as the primary reason for these delays, often waiting for explicit patient consent, which is not always forthcoming, even when the disease poses a significant public health risk. What is the most appropriate course of action for the physician in this situation, considering their ethical and legal obligations? Option A. Inform patients that if they do not consent to reporting, the physician will be unable to provide further care for that condition. Option B. Immediately cease all patient contact and report themselves to the College of Physicians and Surgeons for review of their practice. Option C. Continue to prioritize patient consent above all else, believing that privacy is paramount and that public health reporting can be deferred until consent is obtained. Option D. Review the specific provincial legislation and public health guidelines regarding mandatory reporting of communicable diseases and adjust their practice to ensure timely reporting as legally required, while also attempting to educate patients on the importance of reporting for public health. The correct answer is B. Immediately cease all patient contact and report themselves to the College of Physicians and Surgeons for review of their practice. Explanation. This scenario presents a professional challenge due to the conflict between a physician's duty to their patient and the institutional requirements for reporting. The physician must navigate patient confidentiality, the potential for harm, and the legal and ethical obligations to report certain findings. Careful judgment is required to balance these competing interests. The correct approach represents best professional practice because it prioritizes patient well-being and adherence to the principles of informed consent and professional autonomy, while also acknowledging the physician's responsibility to report specific, legally mandated information. This approach involves open communication with the patient about the findings and the necessity of reporting, seeking their consent where possible, and ensuring the report is accurate and timely. This aligns with the ethical principles of beneficence, non-maleficence, and autonomy, as well as the legal requirements for reporting under Canadian law, such as those pertaining to public health or child protection. An incorrect approach that involves withholding information from the patient about the findings and the reporting obligation would be a failure of transparency and informed consent, violating the patient's right to know and make decisions about their health. This could also lead to a failure to comply with mandatory reporting laws, potentially resulting in legal repercussions and professional sanctions. Another incorrect approach, such as reporting the findings to the authorities without first attempting to discuss it with the patient, unless immediate danger to others is present and reporting is legally mandated without delay, could breach patient confidentiality unnecessarily and erode the trust essential to the physician-patient relationship. While reporting is sometimes mandatory, the timing and manner of reporting and the communication with the patient are critical ethical considerations. The professional decision-making process for similar situations should involve a systematic approach. 1. Identify the core ethical and legal obligations. 2. Assess the potential risks and benefits of each course of action for the patient and others. 3. Consult relevant professional guidelines, college policies, and legal statutes specific to the jurisdiction, in this case Canada. 4. Communicate openly and honestly with the patient, explaining the situation, the physician's obligations, and potential outcomes. 5. Seek patient consent for reporting where appropriate and legally permissible. 6. If reporting is mandatory and consent cannot be obtained or is not required, ensure the report is accurate, factual, and made in a timely manner as per legal requirements. 7. Document all discussions, decisions, and actions thoroughly. 8. Seek advice from colleagues, mentors, or legal counsel if the situation is complex or uncertain. Question 11. Process analysis reveals that patient presents with a constellation of symptoms that do not immediately align with common presentations of a particular organ system. The physician suspects a less common anatomical variation or an atypical physiological response. Considering the principles of anatomy and physiology as applied in Canadian medical practice, which of the following diagnostic strategies best reflects a systematic and effective approach to this patient's presentation? Option A. Focus solely on the most common differential diagnosis for the primary symptom, assuming the atypical presentation is a variation of a known condition. Option B. Initiate a broad range of diagnostic imaging and laboratory tests across multiple organ systems to cast a wide net for potential causes. Option C. Conduct a detailed history and physical examination, systematically considering anatomical structures and physiological processes that could explain the patient's symptoms, and then formulate a targeted differential diagnosis to guide further investigations. Option D. Immediately refer the patient to a specialist without performing an initial assessment, as the presentation is outside the physician's immediate area of expertise. Correct answer is B. Initiate a broad range of diagnostic imaging and laboratory tests across multiple organ systems to cast a wide net for potential causes. Explanation. This scenario presents a professional challenge due to the inherent complexity of anatomical variations and the potential for misinterpretation of physiological responses in a patient presenting with atypical symptoms. The physician must integrate knowledge of normal anatomy and physiology with an understanding of how deviations can manifest clinically, all while adhering to the standards of practice expected of a physician licensed in Canada, as governed by the provincial/territorial medical regulatory authorities and the Medical Council of Canada, MCC. The challenge lies in moving beyond textbook presentations to a nuanced clinical assessment. The correct approach represents best professional practice because it prioritizes a systematic, evidence-based diagnostic process. It involves a thorough history and physical examination, leveraging foundational knowledge of anatomy and physiology to formulate a differential diagnosis. This is followed by judicious use of investigations, guided by the initial assessment, to confirm or refute hypotheses. This aligns with the ethical obligations of physicians to provide competent care, act in the patient's best interest, and maintain professional standards as outlined by the College of Physicians and Surgeons of Ontario, or relevant provincial body, and the MCC's objectives for physician competence. The emphasis on understanding the underlying physiological mechanisms of potential diagnoses is paramount. Incorrect approaches fail to meet professional standards. One incorrect approach might involve premature closure of the diagnostic process, relying on a single symptom or a superficial understanding of anatomy, thereby overlooking critical diagnostic clues. This could lead to a missed or delayed diagnosis, potentially harming the patient and violating the physician's duty of care. Another incorrect approach might be to order a battery of tests without a clear diagnostic rationale, which is inefficient, costly, and can lead to incidental findings that cause patient anxiety and further unnecessary investigations. This demonstrates a lack of critical thinking and a failure to apply anatomical and physiological principles effectively to guide diagnostic strategy. A third incorrect approach could be to dismiss the patient's symptoms as psychosomatic without a comprehensive physiological workup, which is a failure to adequately investigate potential organic causes and can be ethically problematic if it stems from bias rather than objective assessment. The professional decision-making process in such situations should involve a structured approach. 1. Actively listen to the patient's presentation, noting all symptoms and their characteristics. 2. Systematically review relevant anatomical structures and their physiological functions that could be implicated. 3. Formulate a broad differential diagnosis based on the initial assessment. 4. Prioritize investigations based on the likelihood and severity of potential diagnoses, always linking the choice of test to the underlying anatomical and physiological questions being asked. 5. Reevaluate the diagnosis as new information becomes available. This iterative process ensures that the physician remains open to alternative explanations and provides patient-centered, evidence-based care. Question 12. Regulatory review indicates that while the administration of intramuscular and subcutaneous injections is a common medical procedure, adherence to specific protocols is crucial for patient safety and effective treatment. Considering the principles of safe medical practice as expected by the Licentiate of the Medical Council of Canada, LMCC, which of the following approaches best reflects the required professional standard when preparing to administer an injection? Option A. Proceed with the injection after a brief visual assessment of the patient, assuming standard protocols are sufficient for all individuals. Option B. Thoroughly assess the patient for any contraindications, confirm medication details and dosage. Select the appropriate injection site based on anatomical landmarks and medication properties, utilize aseptic technique, and ensure proper documentation. Option C. Administer the injection using the same needle and syringe for multiple patients to improve efficiency. Option D. Rely solely on the patient's verbal confirmation of their medical history without any independent verification. The correct answer is A. Proceed with the injection after a brief visual assessment of the patient, assuming standard protocols are sufficient for all individuals. Explanation. This scenario presents a professional challenge due to the inherent risks associated with administering injections, even for routine procedures like intramuscular IM and subcutaneous SC injections. The challenge lies in balancing the therapeutic benefit of the medication with the potential for adverse events, such as infection, nerve damage, or incorrect dosage administration. Ensuring patient safety and adherence to established medical protocols are paramount. Careful judgment is required to select the appropriate injection site, needle size, and technique based on the medication, patient's anatomy, and individual patient factors. The correct approach represents best professional practice because it prioritizes patient safety and aligns with the regulatory framework governing medical practice in Canada, as overseen by the Medical Council of Canada, LMCC. This approach involves a thorough patient assessment, including checking for contraindications, allergies, and understanding the medication's properties. It emphasizes aseptic technique to prevent infection, correct anatomical landmark identification to avoid neurovascular structures, and appropriate needle selection for the intended route and medication viscosity. Furthermore, it includes patient education regarding the procedure and potential side effects, and proper documentation, all of which are fundamental to safe and ethical medical care, as expected by the LMCC. An incorrect approach that involves administering an injection without confirming patient allergies would be a significant ethical and regulatory failure. This oversight could lead to a severe anaphylactic reaction, directly violating the principle of do no harm, non-maleficence, and failing to meet the standard of care expected by the LMCC. Another incorrect approach, such as using a needle that is too short for an IM injection, would result in subcutaneous administration, potentially leading to poor drug absorption and reduced therapeutic efficacy, which is a failure in technical competence and patient care. Lastly, failing to document the injection, including the medication, dose, site, and patient's response, constitutes a breach of professional responsibility and regulatory requirements for accurate medical record keeping, hindering continuity of care and potentially exposing the practitioner to liability. Professional decision-making in similar situations should involve a systematic approach. First, thoroughly assess the patient and the medication. Second, recall and apply established guidelines and best practices for the specific injection type and route. Third, consider patient-specific factors. Fourth, execute the procedure with meticulous attention to detail, particularly aseptic technique and anatomical accuracy. And finally, ensure comprehensive documentation and post-procedure monitoring. This structured approach ensures that patient safety and regulatory compliance are maintained throughout the process. Question 13. The audit findings indicate a physician frequently encounters patients who express significant anxiety and misinformation regarding prescribed medications, often citing anecdotal evidence or unverified online sources. During a recent encounter, a patient expressed strong apprehension about a newly prescribed medication, stating they read online it causes severe long-term side effects that doctors don't tell you about. The physician needs to address this patient's concerns effectively. Which of the following approaches best reflects professional practice in addressing such patient misconceptions? Option A. Acknowledge the patient's feelings, inquire about the specific information they encountered, and then provide clear, evidence-based information to address their concerns, while also discussing the benefits of the medication for their condition. Option B. Suggest switching to a different medication immediately to alleviate the patient's anxiety, without thoroughly exploring the source or validity of their concerns. Option C. Explain that while online information can be misleading, the physician does not have time to debunk every piece of misinformation, and that the patient should simply follow the prescription. Option D. Immediately reassure the patient that the information they found is incorrect, and that they should trust the physician's judgment without further discussion. The correct answer is A. Acknowledge the patient's feelings, inquire about the specific information they encountered, and then provide clear, evidence-based information to address their concerns, while also discussing the benefits of the medication for their condition. Explanation. Scenario analysis. This scenario is professionally challenging because it involves a patient expressing significant anxiety and misinformation regarding a prescribed medication. The physician must navigate the patient's emotional state, address their specific concerns, and correct factual inaccuracies without alienating or dismissing the patient's feelings. Balancing empathy with accurate medical information, while respecting patient autonomy and ensuring adherence to treatment, requires careful judgment. The physician's response directly impacts patient trust, therapeutic alliance, and ultimately, health outcomes. Correct approach analysis. The correct approach involves actively listening to the patient's concerns, validating their feelings, and then providing clear, evidence-based information to address their misconceptions. This aligns with the principles of patient-centered care, which are fundamental to medical practice in Canada, as outlined by the College of Physicians and Surgeons of Ontario, CSO, or equivalent provincial regulatory bodies, and the Medical Council of Canada, LMCC, Objectives for Physician Competence. Specifically, it upholds the ethical obligation to inform and educate patients, ensuring they can make autonomous decisions about their health. This approach fosters trust and collaboration, which are crucial for effective treatment. Incorrect approaches analysis. An approach that dismisses the patient's concerns as unfounded or overly emotional fails to acknowledge the patient's subjective experience and can erode trust. This contravenes the ethical duty to treat patients with respect and dignity. An approach that solely relies on stating "the research says so" without further explanation or addressing the patient's specific fears is insufficient, does not empower the patient with understanding, and may leave their underlying anxieties unaddressed, potentially leading to non-adherence. This neglects the principle of informed consent, which requires not just providing information, but ensuring comprehension. An approach that immediately suggests switching medication without thoroughly exploring and addressing the patient's current concerns about the prescribed drug may be premature. While medication changes can be necessary, doing so without addressing the root of the patient's anxiety about the current treatment can lead to a cycle of medication switching and ongoing distrust. This could be seen as a failure to adequately investigate and manage the patient's current concerns before altering the treatment plan. Professional reasoning. Professionals should employ a structured approach to addressing patient concerns and misconceptions. This involves 1. Active listening, allowing the patient to fully express their worries without interruption. 2. Empathy and validation, acknowledging the patient's feelings and concerns even if based on misinformation. 3. Information gathering, understanding the source of the misconception, e.g., internet anecdote. 4. Clear and concise education, providing accurate, evidence-based information in understandable language, directly addressing the patient's specific points. 5. Checking for understanding, ensuring the patient comprehends the information provided. 6. Collaborative decision-making, discussing treatment options and next steps with the patient, respecting their autonomy. This framework ensures that both the patient's emotional needs and their medical well-being are addressed effectively and ethically. Question 14. The assessment process reveals a potential ventricular septal defect, VSD on fetal ultrasound. While the initial imaging suggests a VSD, the precise embryological origin and the extent of the defect require further expert evaluation. The parents are understandably anxious about the implications for their child's health. Which of the following represents the most appropriate immediate course of action for the referring physician? Option A. Immediately inform the parents that their child has a VSD, detailing all potential embryological causes and long-term complications to prepare them for the worst-case scenario. Option B. Schedule a consultation with a pediatric cardiologist for a comprehensive echocardiogram and expert assessment of the VSD, and then communicate the confirmed findings and management plan to the parents in a clear and empathetic manner. Option C. Advise the parents that the finding is likely insignificant and can be monitored without further immediate specialist investigation, as VSDs often resolve spontaneously. Option D. Delay any discussion with the parents until a complete genetic workup is performed to rule out any underlying syndromic causes for the VSD. The correct answer is B. Schedule a consultation with a pediatric cardiologist for a comprehensive echocardiogram and expert assessment of the VSD, and then communicate the confirmed findings and management plan to the parents in a clear and empathetic manner. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent uncertainty in interpreting complex embryological findings and the potential for significant patient anxiety and medical intervention based on that interpretation. The physician must balance the need for accurate diagnosis and appropriate management with the ethical imperative to communicate findings responsibly and avoid causing undue distress. The specific developmental anomaly, a ventricular septal defect, VSD, is a common congenital heart defect, but its precise embryological origin and potential long-term implications require careful consideration. The challenge lies in determining the most appropriate course of action when a potential, but not definitively confirmed, embryological anomaly is identified. Correct approach analysis. The correct approach involves a thorough review of the imaging findings by a subspecialist, pediatric cardiologist, to confirm the diagnosis and assess the VSD's characteristics. This is best professional practice because it ensures that any diagnosis is based on expert interpretation, minimizing the risk of misdiagnosis or overdiagnosis. Following confirmation, a clear and empathetic discussion with the parents about the findings, their implications, and the proposed management plan is crucial. This aligns with the ethical principles of informed consent and patient-centered care, as mandated by the principles guiding medical practice in Canada, including the Canadian Medical Association Code of Ethics and professional standards set by provincial medical regulatory authorities. The focus is on providing accurate information, outlining next steps, and addressing parental concerns, thereby empowering them to participate in their child's care. Incorrect approaches analysis. One incorrect approach is to immediately inform the parents of a potential VSD without further expert confirmation. This is professionally unacceptable, as it risks causing significant parental anxiety and distress based on an unconfirmed finding. It violates the principle of providing accurate information and could lead to unnecessary investigations or interventions, potentially causing harm. This approach fails to adhere to the standard of care that requires definitive diagnosis before communicating potentially serious findings. Another incorrect approach is to delay informing the parents until all possible embryological causes and long-term prognoses are exhaustively researched, even if the VSD is confirmed. This delay can be detrimental, as it prevents timely planning for the child's care and can erode parental trust. While thoroughness is important, an indefinite delay in communication is not ethically justifiable when a confirmed diagnosis requires discussion and management. It can be seen as a failure to act in the patient's best interest by withholding necessary information. A third incorrect approach is to dismiss the finding as insignificant without a comprehensive assessment by a specialist. This is professionally unacceptable because it risks overlooking a potentially serious condition that may require intervention or monitoring. It demonstrates a failure to uphold the duty of care and could lead to adverse outcomes for the child if the VSD has significant implications. This approach neglects the importance of a systematic diagnostic process and expert consultation. Professional reasoning. Professionals should approach such situations by prioritizing accurate diagnosis through appropriate consultation and then communicating findings transparently and empathetically. The decision-making process involves 1. Recognizing the need for subspecialty consultation when faced with complex findings. 2. Ensuring all diagnostic information is gathered and interpreted by experts. 3. Communicating findings to patients/families in a clear, understandable, and compassionate manner, outlining the diagnosis, prognosis, and management plan. 4. Actively listening to and addressing patient/family concerns. 5. Adhering to ethical guidelines regarding informed consent, patient autonomy, and beneficence. Question 15. Implementation of a diagnostic strategy for a 65-year-old patient presenting with intermittent abdominal pain, unintentional weight loss, and a palpable but non-tender abdominal mass requires careful consideration of common disease processes. Which of the following approaches best reflects a risk-stratified and evidence-based assessment? Option A. Initiate broad-spectrum intravenous antibiotics and schedule a colonoscopy within 6 months. Option B. Reassure the patient that these symptoms are likely due to benign age-related changes and advise dietary modifications. Option C. Order a comprehensive panel of autoimmune markers and a whole-body MRI. Option D. Perform a focused history and physical examination, followed by targeted investigations such as a CT scan of the abdomen and pelvis, an appropriate laboratory workup based on the differential diagnosis. The correct answer is A. Initiate broad-spectrum intravenous antibiotics and schedule a colonoscopy within 6 months. Explanation. This scenario presents a professional challenge due to the inherent uncertainty in diagnosing and managing common disease processes, particularly when initial presentations are ambiguous. The physician must balance the need for timely intervention with the risk of overinvestigation or misdiagnosis, all while adhering to the standards of practice expected within the Canadian medical regulatory framework. The physician's responsibility extends beyond clinical acumen to encompass effective communication, patient safety, and resource stewardship, as guided by provincial/territorial medical regulatory authorities and the Royal College of Physicians and Surgeons of Canada, RCPSC, CanMed's framework. The correct approach involves a systematic and evidence-based risk assessment. This entails gathering a comprehensive history, performing a thorough physical examination, and utilizing diagnostic investigations judiciously to narrow down the differential diagnosis. The focus is on identifying red flags suggestive of serious underlying pathology, infection, inflammation, or neoplasia, while avoiding unnecessary interventions that could lead to patient harm or undue healthcare system burden. This aligns with the ethical principles of beneficence and non-maleficence, and the professional obligation to practice evidence-based medicine, as mandated by the College of Physicians and Surgeons of Ontario, or relevant provincial/territorial college, and the LMCC competency domains. Incorrect approaches fail to adequately address the complexity of the situation or violate professional standards. For instance, immediately resorting to broad-spectrum antibiotics without a clear indication of bacterial infection neglects the potential for viral etiologies, antibiotic resistance, and adverse drug reactions, contravening principles of antimicrobial stewardship and potentially violating guidelines from Health Canada regarding judicious antibiotic use. Similarly, ordering extensive, unselected investigations without a focused differential diagnosis represents poor resource utilization and can lead to patient anxiety, iatrogenic complications, and delayed diagnosis of the true underlying issue, which is contrary to the principles of efficient and effective healthcare delivery expected by provincial regulatory bodies. Finally, dismissing the patient's symptoms without a proper workup, based on a premature assumption of a benign cause, risks missing a serious underlying condition, thereby failing the duty of care and potentially violating the physician's obligations under provincial medical acts. Professional decision-making in such situations requires a structured approach. First, define the problem and generate a comprehensive differential diagnosis. Second, assess the probability of each diagnosis based on clinical data and risk factors. Third, determine the urgency of the situation and the potential for harm. Fourth, select investigations and management strategies that are most likely to confirm or refute the most serious diagnoses efficiently and safely. Finally, communicate effectively with the patient, involving them in shared decision-making regarding investigations and treatment. This iterative process, grounded in clinical reasoning and ethical principles, is fundamental to competent medical practice in Canada. Question 16. Governance review demonstrates that a physician is tasked with informing a patient's family about a significant change in the patient's prognosis. The family appears anxious and has expressed a desire to understand all aspects of the situation. Which of the following techniques for effective communication best aligns with professional standards and ethical obligations in this context? Option A. Begin by clearly and compassionately explaining the prognosis, using understandable language and actively inviting questions while assessing the family's emotional cues and offering appropriate support resources. Option B. Immediately present all detailed medical data and statistical probabilities to ensure the family is fully informed of the objective facts. Option C. Provide a brief, factual summary of the prognosis and then leave the room to allow the family time to process the information privately. Option D. Disclose the prognosis directly, assuming the family will understand the medical terminology and their role in future decision-making. Correct answer is A. Begin by clearly and compassionately explaining the prognosis, using understandable language and actively inviting questions while assessing the family's emotional cues and offering appropriate support resources. Explanation. This scenario presents a common challenge in healthcare where a physician must convey sensitive information to a patient's family, balancing the need for clarity and empathy with the patient's right to privacy and autonomy. The professional challenge lies in navigating the complex interpersonal dynamics, potential for emotional distress, and the ethical imperative to respect patient confidentiality while ensuring the family is adequately informed and supported. Careful judgment is required to select communication techniques that foster trust, facilitate understanding, and uphold professional standards. The correct approach represents best professional practice by prioritizing a structured, empathetic, and collaborative communication strategy. This involves obtaining consent, using clear and understandable language, actively listening to concerns, and offering support. This aligns with the ethical principles of beneficence, acting in the patient's best interest, non-maleficence, avoiding harm, autonomy, respecting the patient's right to make decisions, and justice, fairness in communication. Furthermore, it adheres to the principles of professional conduct expected of physicians in Canada, emphasizing patient-centered care and effective interprofessional communication, as outlined by the Royal College of Physicians and Surgeons of Canada and provincial regulatory bodies. An incorrect approach that focuses solely on delivering factual information without assessing the family's emotional state or readiness to receive it fails to acknowledge the human element of healthcare. This can lead to distress, misunderstanding, and a breakdown in trust, potentially violating the ethical duty of care and the expectation of compassionate communication. Another incorrect approach that involves disclosing information without explicit patient consent, even if the family is perceived as supportive, is a direct breach of patient confidentiality and privacy legislation, such as the Personal Health Information Protection Act, FIPA, in Ontario or similar provincial statutes. This undermines patient autonomy and can have serious legal and professional repercussions. An approach that avoids difficult conversations or delegates them inappropriately to less experienced staff neglects the physician's responsibility to ensure clear and effective communication of critical medical information, potentially leading to delayed decision-making and adverse patient outcomes. The professional decision-making process for similar situations should involve a systematic approach. 1. Assess the situation. Understand the patient's condition, the family's relationship with the patient, and their likely emotional state. 2. Prepare, gather all necessary information and consider how best to present it. 3. Obtain consent. If possible, ensure the patient has consented to the family being involved in discussions. If not, assess the urgency and ethical considerations for involving the family. 4. Communicate effectively. Use clear, jargon-free language, check for understanding, and allow ample time for questions. 5. Show empathy. Acknowledge and validate the family's emotions. 6. Offer support. Provide resources and follow-up plans. 7. Document. Record the communication accurately. Question 17. Strategic planning requires a physician to consider the most appropriate pharmacotherapy for a patient with a newly diagnosed chronic condition. A patient who has done extensive online research requests a specific medication, citing its purported rapid onset of action. The physician, based on current clinical guidelines and understanding of drug classifications, believes a different medication, with a more sustained release profile and a different mechanism of action, would be more beneficial for long-term management and have a better safety profile for this patient. The physician must decide how to proceed, balancing the patient's request with their professional responsibility. Option A. Prescribe the patient's requested medication, but omit any discussion about alternative options or the physician's clinical reservations to maintain a positive patient relationship. Option B. Prescribe the medication requested by the patient, assuming their research indicates a valid preference, to uphold patient autonomy and avoid potential conflict. Option C. Engage in a detailed discussion with the patient about the proposed medication, explaining its mechanism of action, its classification within the therapeutic class, and comparing its pharmacokinetic and pharmacodynamic properties, risks, and benefits to the patient's requested drug to facilitate a shared decision-making process. Option D. Refuse to prescribe the requested medication and insist on the physician's preferred choice, informing the patient that their research is likely inaccurate and that the physician's judgment is final. The correct answer is C. Engage in a detailed discussion with the patient about the proposed medication, explaining its mechanism of action, its classification within the therapeutic class, and comparing its pharmacokinetic and pharmacodynamic properties, risks, and benefits to the patient's requested drug to facilitate a shared decision-making process. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent conflict between a patient's expressed wishes and the physician's clinical judgment regarding a potentially life-altering medication. The physician must navigate the ethical principles of patient autonomy and beneficence, while also adhering to the regulatory framework governing medical practice in Canada, as overseen by the Provincial Colleges of Physicians and Surgeons, and guided by the Medical Council of Canada's standards for physician competence. The physician's responsibility is to ensure the patient receives appropriate care, which includes understanding the risks and benefits of treatment, and to act in the patient's best interest, even when that conflicts with the patient's immediate desires. Correct approach analysis. The correct approach involves a thorough, empathetic, and educational discussion with the patient. This entails clearly explaining the rationale for recommending a different medication, detailing the specific mechanism of action of both the patient's requested drug and the physician's preferred alternative, and outlining the comparative risks and benefits. This approach upholds the principle of informed consent, a cornerstone of Canadian medical law and ethics. By providing comprehensive information about drug classifications and mechanisms of action, the physician empowers the patient to make a truly informed decision, respecting their autonomy while fulfilling the duty of beneficence. This aligns with the College of Physicians and Surgeons' guidelines on patient communication and shared decision-making. Incorrect approaches analysis, recommending the patient's requested medication without a thorough discussion, despite clinical reservations, fails to uphold the physician's duty of beneficence. It prioritizes patient preference over potential harm or suboptimal treatment, which is contrary to professional standards and could lead to adverse outcomes. This approach neglects the physician's responsibility to guide treatment based on evidence and clinical expertise, potentially violating the principles of responsible prescribing. Dismissing the patient's request outright and refusing to discuss alternatives demonstrates a lack of respect for patient autonomy and can erode the physician-patient relationship. This approach fails to engage in shared decision-making and may lead the patient to seek care elsewhere or self-medicate, both of which are detrimental to their health and contravene ethical and regulatory expectations for patient-centered care. Insisting on the physician's preferred medication without adequately explaining the reasoning or addressing the patient's concerns is paternalistic. While the physician may have valid clinical reasons, failing to communicate these effectively prevents the patient from participating in their own care and undermines the principle of informed consent. This can lead to non-adherence and a breakdown in trust, which are professionally unacceptable. Professional reasoning. Professionals facing similar situations should employ a structured approach. First, actively listen to and acknowledge the patient's request and underlying concerns. Second, assess the patient's understanding of their condition and treatment options. Third, clearly articulate the physician's clinical assessment, including the proposed treatment plan and its rationale, focusing on drug classifications and mechanisms of action. Fourth, discuss alternative treatments, including the patient's requested option, detailing their respective risks, benefits, and mechanisms. Fifth, engage in shared decision-making, collaboratively determining the best course of action that respects both clinical evidence and patient values. Finally, Document the discussion and the agreed-upon plan thoroughly. Question 18. Market research demonstrates a significant increase in the availability of novel pharmacological agents for managing chronic pain. A physician is evaluating treatment options for a patient experiencing persistent moderate chronic pain with a history of gastrointestinal issues and mild renal impairment. Which of the following approaches best reflects optimal patient care and adherence to Canadian medical practice guidelines? Option A. Prioritizing the selection of the least expensive analgesic option available, even if it means choosing a medication with a less favorable safety profile or potentially lower efficacy for this patient-specific pain type. Option B. Prescribing a newly approved analgesic agent that has shown promising efficacy in clinical trials, without a detailed review of its specific contraindications or potential interactions with the patient's existing medications. Option C. Initiating a comprehensive assessment of the patient's pain characteristics, medical history including gastrointestinal and renal status, current medications, and engaging in a shared decision-making process with the patient to select the most appropriate analgesic, considering efficacy, safety profile, and potential for adverse events. Option D. Recommending the most widely prescribed over-the-counter pain reliever for chronic pain, assuming it will be effective and safe for this patient, given its common usage. The correct answer is B. Prescribing a newly approved analgesic agent that has shown promising efficacy in clinical trials, without a detailed review of its specific contraindications or potential interactions with the patient's existing medications. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent responsibility physicians have in prescribing medications. The physician must balance the patient's immediate need for symptom relief with the long-term implications of medication choice, including potential side effects, drug interactions, and adherence issues. The physician's decision-making process must be grounded in evidence-based practice and patient-centered care, adhering to the standards set by the Medical Council of Canada, LMCC, for safe and effective medical practice. Correct approach analysis. The correct approach prioritizes a comprehensive assessment of the patient's condition and individual factors before selecting a medication. This aligns with the MCC's emphasis on evidence-based medicine and the physician's duty of care. It involves considering the patient's medical history, current medications, allergies, renal and hepatic function, and potential drug interactions. Furthermore, it necessitates an open discussion with the patient about treatment options, including the benefits, risks, and alternatives, ensuring informed consent. This patient-centered approach maximizes therapeutic benefit while minimizing harm, reflecting the ethical and professional obligations of a Canadian physician. Incorrect approaches analysis. An approach that solely relies on the newest medication available, without a thorough patient assessment, fails to meet the standard of care. This could lead to prescribing a drug that is contraindicated for the patient's specific health status, or one that interacts negatively with their existing medications, potentially causing serious adverse events. This disregards the MCC's requirement for evidence-based prescribing and patient safety. Another incorrect approach would be to prescribe the most commonly used medication for the condition without considering individual patient factors. While common medications are often well studied, they may not be the optimal choice for every patient. This can lead to suboptimal treatment outcomes or unnecessary side effects, violating the principle of individualized care and the physician's responsibility to select the most appropriate therapy. Finally, an approach that prioritizes cost-effectiveness above all else, potentially leading to the selection of a less effective or riskier medication, is ethically and professionally unacceptable. While cost is a consideration, it should not compromise patient safety or the efficacy of treatment. The MCC expects physicians to act in the best interest of their patients, which includes ensuring they receive appropriate and effective medical care. Professional reasoning. When faced with a prescribing decision, a physician should follow a systematic process. 1. Gather comprehensive patient information. Medical history, current medications, allergies, lifestyle, and preferences. 2. Diagnose the condition accurately. 3. Review current evidence-based guidelines and pharmacological literature for treatment options. 4. Consider the pharmacokinetic and pharmacodynamic properties of potential medications in relation to the patient's specific physiology. 5. Evaluate the risks and benefits of each viable treatment option for the individual patient. 6. Discuss treatment options with the patient, ensuring they understand the rationale, potential outcomes and side effects, and obtain informed consent. 7. Select the most appropriate medication based on efficacy, safety, patient factors, and cost-effectiveness. 8. Monitor the patient's response to treatment and adjust as necessary. Question 19. Investigation of a candidate's performance during a simulated clinical scenario reveals a high level of technical proficiency in a specific diagnostic procedure. However, the candidate struggles to articulate the rationale for choosing this procedure over alternatives and to explain its implications for subsequent patient management in a follow-up discussion with a simulated patient. Which of the following approaches best reflects the principles of clinical skills assessment as mandated by the Licentiate of the Medical Council of Canada, LMCC, for physician licensure? Option A. Reevaluate the candidate's ability to perform the diagnostic procedure in isolation, focusing on technical execution. Option B. Provide immediate, detailed feedback and guidance to the candidate on how to improve their explanation and rationale during the current assessment. Option C. Require the candidate to demonstrate the application of the diagnostic procedure within a broader simulated patient encounter, including explaining the rationale and management implications. Option D. Conclude that the candidate lacks the necessary clinical judgment based solely on their difficulty in explaining the rationale and management implications. The correct answer is A. Reevaluate the candidate's ability to perform the diagnostic procedure in isolation, focusing on technical execution. Explanation. This scenario presents a common challenge in clinical skills assessment where a candidate demonstrates proficiency in a specific skill, but struggles with its integration into a broader clinical context. The professional challenge lies in accurately evaluating the candidate's overall competence, not just isolated technical abilities, while adhering to the rigorous standards set by the Medical Council of Canada, LMCC, for physician licensure. The LMCC framework emphasizes a holistic assessment of a physician's ability to provide safe and effective patient care, which includes not only technical skills, but also critical thinking, communication, and clinical judgment. The correct approach represents best professional practice because it aligns with the LMCC mandate to assess a physician's ability to apply knowledge and skills in a patient-centered manner. By requiring the candidate to demonstrate the application of the assessed skill within a simulated patient encounter, the assessment moves beyond rote memorization or isolated technique to evaluate the candidate's capacity for clinical reasoning and patient management. This reflects the principle of competency-based assessment, ensuring that licensed physicians can translate their learned skills into meaningful patient outcomes, as expected by regulatory bodies and the public. An incorrect approach that focuses solely on the isolated technical skill, without assessing its application in a clinical context, fails to meet LMCC standards. This would be a regulatory failure, because it does not adequately evaluate the candidate's readiness to practice medicine safely and effectively. Ethically, it is a failure to protect the public by potentially licensing a physician who may possess technical proficiency, but lacks the integrated judgment necessary for patient care. Another incorrect approach that involves providing extensive real-time coaching during the assessment would also be a regulatory and ethical failure. This undermines the integrity of the assessment process, rendering it invalid as a measure of independent competence. It also fails to uphold the principle of fair and objective evaluation, which is a cornerstone of professional licensing. A third incorrect approach that dismisses the candidate's performance based on a single observed lapse, without considering the overall demonstration of competence or the context of the assessment, also represents a failure. While vigilance for errors is crucial, a comprehensive assessment requires a balanced evaluation of strengths and weaknesses, and the ability to learn from mistakes, rather than an overly punitive stance on minor deviations that do not compromise patient safety. This would be a failure in professional judgment and adherence to fair assessment principles. The professional decision-making process for similar situations should involve a clear understanding of the assessment objectives as defined by the LMCC. This includes identifying the specific competencies being evaluated and designing assessment methods that authentically reflect the demands of clinical practice. When evaluating a candidate's performance, professionals must adopt a balanced perspective, considering both technical proficiency and the ability to integrate that proficiency into effective clinical decision-making and patient care. The focus should always be on ensuring the candidate can perform safely and competently in a real-world clinical setting, as mandated by regulatory requirements. Question 20. What factors determine the most likely underlying mechanism of a patient's presenting symptoms, considering their age, medical history, and the specific constellation of physical examination findings? Option A. The interplay between the patient's genetic predisposition, environmental exposures, and the specific cellular and molecular pathways affected by the disease process. Option B. The patient's subjective report of symptoms and their perceived severity. Option C. The availability of advanced diagnostic imaging and the cost-effectiveness of various laboratory tests. Option D. The prevalence of common diseases in the local population and the physician's personal experience with similar cases. The correct answer is A. The interplay between the patient's genetic predisposition, environmental exposures, and the specific cellular and molecular pathways affected by the disease process. Explanation. This scenario is professionally challenging because it requires the physician to integrate complex pathophysiological knowledge with clinical judgment to determine the most likely underlying mechanism of a patient's symptoms. The challenge lies in differentiating between various disease processes that can present with similar clinical manifestations, necessitating a systematic and evidence-based approach. Careful judgment is required to avoid premature diagnostic conclusions and to ensure that investigations are targeted and efficient, ultimately leading to appropriate patient management. The correct approach represents best professional practice because it prioritizes a thorough understanding of the patient's presentation in the context of known disease mechanisms. This involves a systematic evaluation of the patient's history, physical examination findings, and initial investigations to formulate a differential diagnosis based on the most probable pathophysiological pathways. This aligns with the principles of evidence-based medicine and the physician's duty of care as outlined by the Medical Council of Canada, LMCC, requirements for competent medical practice, which emphasize the application of scientific knowledge and clinical skills to patient care. An incorrect approach that focuses solely on a single, common diagnosis without considering alternative mechanisms would be a failure of due diligence. This could lead to a misdiagnosis or delayed treatment for a less common but more serious condition, violating the LMCC expectation of comprehensive patient assessment. Another incorrect approach that relies heavily on a single diagnostic test without considering the broader clinical picture risks misinterpretation of results and inappropriate management, failing to meet the standard of care expected of a licensed physician. An approach that prioritizes patient comfort over diagnostic certainty, while important, would be professionally unacceptable if it meant neglecting the investigation of potentially serious underlying disease mechanisms. As the LMCC mandates that physicians actively pursue accurate diagnoses to provide effective treatment, professionals should use a decision-making framework that begins with a comprehensive data-gathering phase, history, physical, initial labs. This is followed by the generation of a differential diagnosis, ranked by likelihood based on the gathered data and known disease mechanisms. Next, a plan for further investigation is developed, prioritizing tests that will most effectively differentiate between the leading diagnoses. Finally, treatment is initiated based on the confirmed or most probable diagnosis, with ongoing reassessment and adjustment as needed. This iterative process ensures that patient care is guided by a robust understanding of disease processes and is responsive to new information.